Okay, one viewer on the line. Hello subscribers, I am live now. There is audio and video, everything clear. Okay. So good evening everyone. So this is Reshma Tirupati and here I am coming with the second part of JIPMER Nursing Officer question paper part 2. So already I have taken part 1. So if you want to know get the link of part 1, you can go into my description box. There you will get part 1 and this is part 2. And today we will be discussing around 50 questions as tomorrow you have JIPMER exam. So all the best for all the clients, and the notes, today's notes I will be updating in my Telegram channel as also in WhatsApp channel. So யாராவது லைவ் வந்திருக்காங்களோ கண்டிப்பா லைவ்ல வந்து ஷேர் பண்ணுங்க. That is audio and video everything is clear to you people, so that we can start off the class. And why I have kept railways. Okay. Okay, so almost 9 members have come online. Okay, waiting for your response. So I thought of taking class by 5 p.m. but due to some technical issue, I was unable to take the class. And as you know, today is my post night duty off. Since 3 days I'm doing night duties, and today I got off. So I thought the exam is on after 19th or something. Then one of my ex-students has messaged me that my exam is tomorrow. So just now I came to know that you people have exam. Okay. So it's almost 4 minutes. Okay. Okay, let me start with the first question. Kiranmai PLS. Okay, good evening Kiranmai. Is my audio and video everything clear? So is the question visible on screen? So Kiranmai has come live. So a patient is brought to the emergency department after road traffic accident. The patient's motor score is 2 on GCS. This means the patient response is option A, decerebrate response, B, decorticate response, option C, withdraws from touch, or option D, withdraws to pain. Okay, thanks for the confirmation Kiranmai. See, if you look at the, here they have mentioned here is, that is road traffic accident they have mentioned, right? So here they have mentioned about road traffic accident, RTA, and the patient GCS is 2. GCS is Glasgow Coma Scale, which is used to assess the level of consciousness. And so here the patient score is around 11. If you look at the Glasgow Coma Scale, so the Glasgow Coma Scale, here we assess 3 things. One is eye opening response, verbal response, and motor response. In the eye opening, the maximum score is 4 and the minimum score is 1. Okay, and the minimum is 1. And verbal response, the best score is 5, the highest response, and the least score is 1. 1 second. For the motor response is when you try to pinch them, or the best their muscle strength we will note through the motor response, and the maximum score is 1. So if you look at the total highest score is around 15 and the minimum lowest score is 3. Okay. So, even for the death patient or patient who is in deep coma patient, they will get a score of 3 because in eye response they are not going to respond. Death patient or coma patient will give them 1. In verbal response, if they are not responding, we will give them 1. In motor response, muscle strength, we will give them 1. So, whether it is a death patient or in a patient who is in a deep coma state, we are going to give them around score of 3. So, this is about Glasgow coma scale. If you look at the images here, see, I have put images because images have very good memory on you when you are learning anything. நீ ஏதாவது இதை லேர்ன் பண்ணும்போது அது உங்களுக்கே தெரியும். இப்போ இமேஜஸ் இருந்தால் அது லாங் டைம் மெமரியில ரொம்ப நிறைய நாள் ஸ்டே ஆகும் இல்லையா? So, that's why I have taken images here. So, this is first image is here is this is eye opening response they are checking, and here the second image, this is they are checking the vital signs, and the bottom 2 images here, option D and option D images, here they are checking the motor reflex. Okay. So, option C, they are taking the motor response, means the nurse is asking the patient to just grab her hands with her full strength, and so and the nurse is moving back. And if you look at the fourth here, we are checking the patient response to pain. These are the methods of checking the GCS scale. And this is one of the decorticate and decerebrate responses in the head injury cases, especially when the patient has these head injury cases, the patient will undergo 2 types of response. One is decorticate and the other is decerebrate posturing. So, decerebrate posturing lo emuntundi, if you look at the legs, complete plantar leg is flexed, okay, and the hands are twisted outwards and the hands is in prone position and the hand is extended and adducted. Adducted means once which is close to the midline of the body is called as the adducted. Okay. So, Kritika Rajuvel, good evening. So, don't forget to share in your nursing groups, and good evening to one and all, and try to share in the most social platforms, let it be WhatsApp or Telegram or Facebook, so that the students who want to learn, it will be easy to learn, and those who want to come and comment live in the session, you can join my membership. So, in the bottom of the screen you will find an option called join the membership, and you can comment live. Okay. So, this is the decerebrate posturing. So, cases who have head injury and if they exhibit these kind of signs and symptoms, their survival chances are very, very less. Okay. So, the answer for this particular question is, that is decerebrate response. Next, 52nd question. So, already 50 questions I have taken in the previous session, and this is the 51 question and 52nd question. So, all of the following are types of lochia except alba, serosa, serum and rubra. So, those who have come online, you can comment and come live, and you can comment in the live session. Okay. So, here they have mentioned about the lochia. Lochia is nothing but post delivery. After delivering birth of a baby, the mother has a vaginal discharge which contains 3 types of discharge, that is alba, lochia serosa. First one is lochia rubra and lochia serosa and lochia alba, right? So, this really sounds like my name, Reshma. So, it will be easy for you to remember when it comes to the lochia rubra, serosa and alba. So, here the question is, all of the following are types of lochia except. So, the question is except. Yes, 52 you have told correctly, Kiranmai and Kritika Rajwell. It is serum. Serum is not a part of the lochial discharge. Okay. If you look at the options here, lochia rubra discharge will be seen for around 1 to 4 days after delivery of the baby, and lochia serosa, this will be in yellowish or pink color or pale brownish in color, and the discharge will be there for around 5 to 9 days. In exam, questions are coming in such a way that lochia rubra is for how many days, lochia serosa is for how many days, and lochia alba, the last discharge, which is pale white in appearance. This is for around 10 to 15 days. So, based on this we can write the answer. So, all these types of things here is, that is vaginal discharges, lochia rubra, serosa and alba. So, the answer for this 52nd question is it is serum. Then coming to the 53rd question. A nurse has just performed an angiotube insertion procedure. So, most accurate method for confirming the angiotube placement is which one? X-ray, auscultation, observing patient for aspiration of content and pH monitoring, and dip in a bowl of water. Here the question is, the nurse has performed nasogastric tube insertion, just now performed. So, immediately how she can confirm? Endha madri confirm panna mudiyum? So, most accurate method for confirming the angiotube placement is which one? So, if you look at the angiotube insertion process, so this is how we measure the angiotube insertion, from the tip of the bridge of the nose, from the ear lobule, then to the xiphisternum. This is how we measure the angiotube insertion, right? And here I have shown you the images of this bandage, how the butterfly shaped bandage we will use for this angiotube to secure the angiotube. Endha madri and the angiotube secure panna mudiyum, and the images da inga vechirukken. So, if you look at the after angiotube insertion, so after you have done the angiotube insertion, okay. So, once you have done the angiotube insertion, how we will confirm? So, the first best method is X-ray. The first best method is X-ray, because in X-ray the image, it will be completely visible in the X-ray. Then abdominal pH, if you aspirate the abdominal contents, the pH of the abdominal contents is acidic in nature, which will be less than 5. The pH of the HCl, abdominal content, will be less than 5. Then auscultation. Take an empty syringe, 10 to 20 cc of syringe, and you push through the angiotube and you keep a stethoscope. Stethoscope, we keep it on the abdomen and we will hear for the sounds. Okay. So, once we hear for the sounds, here we will feel a gushing sound, that is called as the auscultation. Then dip in a bowl of water. So, once you keep the tip of the angiotube in a bowl of water, in the bowl of water if you are keeping the angiotube, if water bubbles are coming, it indicates the presence of angiotube in the lungs. So, as soon as you feel the angiotube is in the lungs, you have to take out. So, these are the methods of confirmation of angiotube. And here the first best method to confirm the placement of angiotube is, that is X-ray. Can you see the image here? Can you see the image here? See, the angiotube is completely visible on the X-ray because of the radio opaque line over it. The radio opaque line over it. Okay. Next question. The patient is brought to the recovery room post thyroidectomy. So, after thyroid procedure, thyroidectomy, removal of thyroid gland. So, which of the most appropriate method to observe for further bleeding? So, the patient is brought to the recovery room. So, which is the best method to observe for further bleeding, check whether the bleeding is happening or not. So, this is the thyroid gland. Okay. So, observe for hemorrhage at the operative site, at the back of the neck and the shoulder. Observe pressing for any leakage of the blood. Observe the drainage tube for signs of bleeding. Observe whether the patient is frequently swallowing. Frequently swallowing is, we can see in epistaxis cases. Means if in the pharynx region any bleeding, sort of bleeding is there, we can see the patient is frequently swallowing. Okay. And rest of the given options here is, so after thyroid gland removal, there will be complete swelling of the throat area or in the neck area. So, here bleeding is the most common potential complication after thyroidectomy. So, when the patient is lying down, we are supposed to check at the back of the neck. So the correct option here is we are going to check at the back of the neck, shoulder region for any signs of hemorrhage. So the option A is correct, 54A. So at the back of the neck we are going to check for any signs of bleeding. For those who are online, are you able to understand the explanation? Okay. A patient's Foley's catheter was removed 24 hours before surgery. 24 hours before it was removed. So on assessment, the nurse finds out that the urine output is less than expected volume. So which of the following is the priority nursing action? So 24 hours before the Foley's has been removed. So what is the nursing action here? Administer injection Lasix 10 mg IV, ambulate the patient, check bladder for distension and notify the doctor. See, once the Foley's is removed, we are going to check for the patient urine output. If the urine output is decreased, it indicates what? It indicates bladder distension. Bladder distension, if you look at the kidneys and the urinary bladder, if the urine is, if there is any obstruction, so there will be a chances of abdominal distension. So as soon as Foley's is removed, we have to check for any abdominal distension, whether the urine output is adequate or not. If the urine output is decreased, it indicates that abdominal distension. So we are going to check for the abdominal distension in the patient. So 55 Kiranmai and Kritika, you are saying ambulate the patient. No. We are going to check the bladder for 55C is correct. Okay. So we are going to check the bladder for distension. (56) Following delivery, the nurse suspects atonic PPH in the client. So which among the following is the priority nursing intervention? So nurse suspecting atonic PPH. See, PPH is nothing but postpartum hemorrhage. So as soon as after delivery in the puerperium period, there is atonic is irregular muscle contraction of the uterus. So it is an irregular muscle contraction of the uterus. So which among the following is the priority nursing intervention? So whether you will massage the uterus or administer 10 units of oxytocin or administer ergometrin or report to the doctor. See, when the woman is in labor, we administer oxytocin, right? So due to some excessive dose of oxytocin, there will be irregular contraction of the uterus. Since if this is uterus, imagine this is the uterus. So atonic uterus is irregular contractions. So irregular contractions will be there due to the medications effect. So here what will be our priority nursing intervention? They are asking edu vandu priority aganum ante ikkada mana deniki priority ivvali. So we are supposed to massage the uterus. So massaging the uterus is the best priority nursing intervention here. Next question, 56th Kritika and Kiranmai, you have given the good answer. Okay. Which of the following drug is contraindicated in a patient with congestive heart failure? Whether it is diltiazem, digoxin, furosemide or captopril. Contraindicated. See, what is the meaning of congestive heart failure? Congestive heart failure is, here the heart is unable to pump blood. Okay. So here the condition is which drug is contraindicated. Here? See, diltiazem is a such kind of drug. Let me show you. So the main causes of this CHF is coronary artery disease, heart attack, that is myocardial infarction, high blood pressure and cardiomyopathy. See, diltiazem drug is contraindicated in CHF. Why? Because Diltiazem is a calcium channel blocker. This is a calcium channel blocker. And what is this calcium channel blocker causes? It causes relaxation of blood muscles. So, once it causes relaxation, there will not be adequate pumping of the heart. So, that is why in a congestive heart failure, diltiazem drug is contraindicated. Next question, 58th question. So, look at the question, I will come back. Okay. So, an unconscious patient is brought to the emergency room after a road traffic accident. So, which of the following is the priority intervention in this patient? So, this is 50, assess level of consciousness, assess vital signs, airway management and management of bleeding. See, road traffic accident I already have told you, that is mainly any external injuries when the person get accident to any external like vehicle or road traffic accident. So, maybe due to overspeeding of the vehicle or rash driving or violation of rules or under the influence of alcohol if they are driving, there may be a chances of this road traffic accident. Here in the road traffic accident, our priority action is to check for the airway. Okay. After airway, we will go for breathing and circulation. Then if any bleeding consequences are there, we will also check for bleeding symptoms and try to control the bleeding. Then check the vital signs. So, ikkada ichina interventions anni correct, but we will be, the priority intervention here is check the airway. Okay. So, airway management is very, very essential when you are going for the RTA cases. So, 58C, Kiranmay and Kritika, you have answered it correctly. Then 59th question, which of the following sign is seen in pancreatitis? Pancreatitis is what? Inflammation of the pancreas, right? So, which sign we will see? Kernig sign, Murphy sign, Cullen sign or Psoas sign? See, if you look at the pancreas, pancreatitis is inflammation of the pancreas. It is mainly due to gallstones or alcoholism is the main cause. And Cullen sign is something, but if you look at the abdominal region near the umbilicus, so there will be ecchymosis around the umbilicus, ecchymosis and edema around the umbilicus. So, this is called as what? This is called as Cullen sign. Okay. So, the answer for this question is, that is Cullen sign. Here you can see the image of the Cullen sign. Okay. So, 59C. Okay. Next is 60th question. Which of the following method is most effective in prevention of teeth discoloration while administering iron syrup? See, when the iron levels are very less, that physician prescribes the iron syrup for the patient. So, when anybody is consuming this iron syrup, there may be a chances of tooth discoloration, right? To prevent this tooth discoloration, what steps should be taken? Dilute syrup with glass of water, then mix iron syrup with lemon juice, use syrup through straw, and option D is rinse mouth with water after ingestion of syrup. See, all the options which I have told here, yes, iron syrup can be given with lemon juice because it is rich in vitamin C. This is one correct option. Diluted syrup is not recommended, and giving the syrup through straw. Here the question is how you will prevent the discoloration. So, giving the syrup through the straw will prevent discoloration if the patient completely bypassing the tract, right? So, the correct option is give a straw. give straw, syrup through the straw, so it will prevent the discoloration of the teeth. Next question. All of the following are the signs of respiratory acidosis, right? So, here the question is, except that particular thing, except that particular option, all are the signs of respiratory acidosis, whether it is headache, blurred vision, confusion or high alertness. Which one? 61 question. See, what is the meaning of this respiratory acidosis? Respiratory acidosis is where the lungs is, see, this is the see, so these are the lungs, right? I don't mind with the image, okay? See, when the lungs is unable to remove all the carbon dioxide, when the lung is unable to remove all the carbon dioxide, that is called as the respiratory acidosis, okay? The lung is not unable to excrete the carbon dioxide from the lungs. So, this mainly this kind of condition where we can observe in cases like COPD, asthma, and those who have sleep apnea, means absence of respiration during sleeping, and obesity patients, there we can see these signs and symptoms, okay. So, the other thing here in the given options, high alertness is given. High alertness is not a sign of respiratory acidosis, means the patient will not be highly alert. See, carbon dioxide is not going out, and so gradually what will happen? The oxygen levels are decreased. So, once the oxygen levels are decreased, they will have symptoms like headache, blurred vision, confusion, okay. High alertness will not be there. So, except high alertness, all the other conditions will be present. Next, 62nd question. Guerin sign is mostly seen in maxillofacial trauma, basilar fracture or clavicle fracture or cervical fracture. So, where we can see this Guerin sign? I will show you the image. So, this is the image of a maxillofacial. Maxilla is nothing but the upper lip, upper jaw and face fracture. Jaw and face fracture, they will have the ecchymosis. Can you see the ecchymosis here? The discoloration of the upper palate. The discoloration of upper palate is called as the Guerin sign or bruising of the palate. So, inside of the mouth it will be there, and after 5 to 7 days it will subside, the swelling will subside. It is mainly occurring due to the presence of this palatine arteries. Palatine arteries bruising, discoloration, this is called as the Guerin sign. So, mostly we can see this Guerin sign where in, that is maxillofacial trauma. Next question. Those who are online, if you want to comment in the live, just join my membership. At the bottom of the screen you will find join option. Click on the join so that you can join the membership and you can comment in the live. Okay. Most common cause of urinary tract infection is E. coli, staphylococcus, streptococcus or pneumococcus. So, the most common UTI, yeah, this is a very simple question, ma. Even first year BS nursing student can also answer, that is E. coli. That is Escherichia coli is the most common cause of UTI infection. So, here we have the E. coli. Next question. According to WHO, surgical site infections are infections that occur at surgical site within how many days? Here we are talking about SSI, that is surgical site infection. So, surgical site infection is when doctor performs any surgery. After surgery, so within how many days if the patient is getting infection, that is called as SSI. How many days? 7 days, 15 days, 30 days or 42 days. So, 64 you are saying, Kiranmai you are saying it has 7 days. But See, the surgical site infections are of three types, that is superficial, deep incision, or organ or space SSI, surgical site infection. So, according to WHO, that is within 30 days. So, within 30 days, if the patient is getting infection after the surgery, that is called as SSI. Here I am not asking about nosocomial infection. Nosocomial infection is hospital acquired infection. Here I am not asking about nosocomial. I am asking about surgical site infection. So, the answer is 30 days. Next, 65th question. Most common complication of respiratory system after abdominal surgery. See, after abdominal surgery, what is the complication of respiratory system? Whether it is bronchitis, emphysema, atelectasis and pneumonia. See, when there is an abdominal surgery, so this is lungs, right? So, this is lungs, right? So, here we have diaphragm. Mostly surgeries are performed on the abdomen with general anesthesia. So, what is this general anesthesia will do? General anesthesia will cause this diaphragm dysfunction. This will cause diaphragm dysfunction. So, because of this diaphragm dysfunction, there may be a chances of atelectasis, that is collapse of the lung, that is collapse of lung. So, the most common side effect of this general anesthesia is where we can see atelectasis. Okay. So, the most common complication of respiratory system is that is atelectasis. Next, 66th question. Antibiotic prophylaxis before dental procedure is mainly given for the prevention of surgical site infection, infective endocarditis, gastrointestinal tract infection or ear infection. See, dental procedures are usually invasive, right? They are invasive. Dental procedures are invasive. There may be a chances of bacteremia, means the entry of bacteria into the blood, bacteremia into the blood. So, if at all bacteremia happens, there may be a chances of sepsis. So, because of this, antibiotics are given. Antibiotics are given before all the dental procedures. So, there may be a chances of infective endocarditis. Okay. So, that is why antibiotics like augmentin 500 mg 4 tablets 1 hour before the procedure is given, or clindamycin 300 mg 2 tablets 1 hour before the procedure is given. So, infective endocarditis, there may be a chances of transient bacteremia. To prevent that, we are giving antibiotics, and usually there may be a chances to prevent infective endocarditis. So, surgical site infection is not the answer. 66B, Kritika Rajwell, yes. Gangadhara, welcome Gangadhara, how are you? Welcome Gangadhara, how are you? So, infective endocarditis, antibiotic prophylaxis, answer is infective endocarditis. Next, 67th question. A patient is scheduled for an elective surgery. All the following are important nursing responsibilities 1 day before surgery except. So, patient is posted for surgery. Okay. All the important are nursing responsibilities except one thing are nursing responsibilities. Patient education, obtaining consent, PSC checkup, rehabilitation planning. See, here when the patient is posted before surgery, patient education, obtaining consent, PSC checkup, everything will be done by physician, by the doctor. Rehabilitation is something we will be doing in the recovery phase. Recovery phase means after the surgery. Here the question is before surgery. So, before surgery means except rehabilitation program, all will be done before the surgery. So, the answer for this question is, that is 67 is D. 67D, Kritika Rajwell is right. It is rehabilitation planning. Because rehabilitation is planned only during the recovery phase. only during the recovery phase we will plan. Especially after injury, surgery and illness. Okay, Gangadhar, Kritika, Kiranmay, from what is your native place? From where are you? Whether you are for AP, Telangana or Tamil Nadu or from Pondicherry? So, whether people are planning to write NORCET 7 also, tomorrow we have JIPMER exam. So, day after tomorrow we have NORCET exam. So, you three of you are writing only JIPMER exam or you are writing NORCET also, let me know in the comment section. Okay, Gangadhar is from from Karnataka, right? Okay, Kritika is from Tamil Nadu, okay. So, whether you are writing both NORCET and JIPMER or JIPMER alone. So, next question. A patient with the diagnosis, I am from Madanpalli, Chittur. Oh, man Chittur pilla nuvu, okay. JIPMER only. Kritika, JIPMER you are writing, okay. Very good. So, Kritika, you have been attending my classes regularly. So proud of you, thank you. So, a patient with the diagnosis of end stage renal disease is admitted in ICU. End stage renal disease means completely there is non-functioning of the kidneys. So, all of the following are appropriate nursing diagnosis for the patient except. So, in the end stage the patient is there. See, we have acute renal failure, chronic renal failure and ESRD, right. So, except that option, rest of the things are correct. Excess fluid volume excess we can see, decreased RBC we can see, electrolyte imbalance we can see, but whereas impaired immune function, okay, impaired immune function we cannot see in this the end stage renal disease. See, when they are going for this renal transplantation appudu, they will, after renal transplantation, they will suppress the immunity by giving immunosuppressant drugs. Whereas, only this chronic renal failure or end stage renal disease will not cause impaired immune function. Okay. So, the answer for this question is impaired immune function. Next question. A patient is brought to ICU from nephrology department. Nurse on duty there is bleeding from sheath. So, the nurse on duty noticed that there is a bleeding from the sheath side from the right hand. So, sheath side there is a bleeding. So, which of the following nursing priority action in this situation? What is the immediate action when she is observed for bleeding? She is observed for bleeding. Call to dialysis room and ask individual dialysis nurse to help. Check the blood pressure immediately. Immediately apply pressure on the bleeding site with sterile gauze or inform the doctor. So, option D and option F are what you are, I didn't get 69. 69? Yes. A Jyotika, welcome to Healthcare Hub. Thanks for joining, Jyotika. So, inform the doctor. See, here we are watching for bleeding. So, immediately response should be immediately stop the bleeding. So, take a sterile gauze and try to stop the bleeding. The option is option C. So, Kritika Rajwell is correct, that is immediately apply pressure on the bleeding site with sterile gauze. Rest of the interventions are also correct, but the first priority intervention is this one. Okay, the first priority intervention should be this one. So, the rest of the interventions will be like, we will be checking the blood pressure, we will be informing the doctor, then we will call the dialysis technician nurse for the help. Good evening, Jyotika. Next, the most common cause of upper respiratory infection is what? Upper respiratory infection, whether it is adenovirus, rhinovirus, influenza virus or enterovirus. So, the most common tract infection of upper respiratory tract infection. See, if you look at the upper respiratory tract, see, our respiratory system helps for breathing, right? So, in the upper respiratory tract, here we have, that is, so this is the head, okay. So, in upper respiratory tract, we have nose, the nasal cavity, the pharynx, the posterior side we have pharynx and the larynx we have. So, all this comes under the upper respiratory tract, and the lower respiratory tract, as soon as they go down, here we have lungs, and we have trachea in the lower respiratory tract. Then bronchial tree, we have bronchial tree and its branches we will find in the lower respiratory tract infection. Here the question is upper respiratory tract infection. When there is upper respiratory tract infection, there will be signs and symptoms like runny nose, sneezing, sore throat, headache. So, the main causative organism in the upper respiratory tract infection is the rhinovirus. So, that is rhinovirus is the right answer. So, 70th option, Kritika Rajwel as well as Kiranmay, you have given the correct answer. Gangadhar, okay, good. You have given 70B option. Happy to see you, ma'am. Oh, Jyotika, you are my student at Apollo. Oh, thank you so much. Happy to see you, ma'am. I am a student in Argon Apollo College of Nursing. Thank you, Jyotika. Hi. So, Acon students are also following me on YouTube. Thank you so much. Ask all your classmates to subscribe my channel and watch my videos. Okay. Why I have put this only membership option in the live section? Because last time నేను ఎప్పుడైతే ఈ లైవ్ వెళ్ళానో one of the person has commented like, ma'am, means I am repeatedly I am answering questions అడిగే కొద్దీ అందరూ ఆన్సర్ చేస్తున్నారు, ఒక 2-3 comments నేను మిస్ అవుతున్నా. 2-3 comments మిస్ అయిన మాత్రాన that person is saying whether you will answer my comment or shall I unsubscribe your channel. Means అంటే మీరు లైవ్లో వచ్చినప్పుడు ఆన్సర్ చేయండి అమ్మా, 1-2 మిస్ అయినప్పుడు బ్యాడ్గా ఫీల్ అవ్వద్దు, అలాగని అలాగా బెదిరించకూడదు కదా. I will unsubscribe your channel if you are not commenting my answer, that's not a good thing. Okay, so don't do such activities. That's why I have come up with only membership comments. Okay, next 71st question, the patient's blood type is B negative, and the nurse informs the family members that packed RBCs, PRBCs would likely to be used by family members whose blood type is, so here they are asking for B negative blood group. Okay, so for that B negative, who can be the best donor, whether it is A positive, B positive, B negative or AB negative. If you just look at the blood groups, there are 4 types of blood groups, right? 4 types of blood groups and around 8 blood types can be found. 8 blood types. How? A negative, A positive, B negative, B positive, AB negative, AB positive, O negative, OB positive. So, like that 8 blood types we can find. So, what is the specialty of this A group? A group contains A antigen and B antibody. The same way B group contains B antigen and antibody A. Then AB group contains both AB antigen and there are no antibodies. And in O group there are no antigens. It contains only antibodies of A and B. So, here the rhesus factor decides whether it is decides whether it is a negative blood group or it is a positive blood group. That is called as the rhesus system. So, here for the B negative patient we need only B negative donor. Next question, treatment for hemophilia will likely include periodic self-administration of fresh frozen plasma, factor concentrates, whole bloods or platelets. See, hemophilia is a disorder where the blood fails to coagulate. Okay, so there are certain factors which help in blood clotting like factor 8. Then so there is a factor 8. One second. Okay. So factor 8, factor 9 and factor 11. So the most common type of hemophilia is hemophilia A, is the very common type. Then hemophilia B, where the clotting factor 9 is deficient, and this is also called as the Christmas factor. Then hemophilia C, where clotting factor 11 is involved. So, the patients who have this hemophilia problem, they mainly have problem with blood coagulation. So, the self administration, here the question is periodic self administration of which one? So, we will administer factor concentrates. So, here the question is factor concentrate should be taken to prevent this blood loss. If there is any surgery, post surgery, there will be minimum chances of bleeding. If these factor concentrates are not there, even small injury అంటే కింద పడినా లేకపోతే ఏదైనా రాసుకున్నా ఎలాంటి దెబ్బలు తగిలినా కూడా వీళ్ళకి త్వరగా wound అనేది హీల్ అవ్వదు. సో ఫ్యాక్టర్ కాన్సన్ట్రేట్స్ అనేవి వీళ్ళకి చాలా చాలా అవసరం. Next question, which of the following blood pressure reading of a child aged between 3 and 5 years is considered abnormal? See, blood pressure reading which is considered normal, 96/42 mm of Hg, 105/62, 60, 112/65 and 115/66 mm of Hg. See, the blood pressure is usually measured diastolic blood pressure for children who are 3 to 5 years, preschoolers. 100/60 mm of Hg is considered as normal blood pressure. Okay, so here the values like 105/60, 112/65, 115/56, they are very close to this value, except this is considered as the hypotension in children. So here the abnormal value is 96 by excuse me. So 96/42. So how many have given the correct answer? 73A. 73A has not come. So one has given D, option C, option C, like that you have given. So the correct answer is 96/42 mm of Hg. Next question. In a patient with suspected head injury, frequent assessments are performed. So to determine if the client has developed intracranial pressure, which of the following option correctly describes there is increased intracranial pressure? Okay, increased in cerebral perfusion, where there is an increased blood supply, or displacement of brain tissue, or improved brain tissue oxygenation, or increase in serum pH. See, inside of the brain, let me okay. See, if you look at the inside of the brain here, this image is okay. See, when there is an head injury, there may be a chances of this intracranial pressure, this ICP will increase due to the increased pressure from the inside of the brain, or there will be any like a clot, blood clot. So due to this blood clot, there will be swelling of the brain tissue from inside to out. So there may be a chances of displacement of brain tissue. So there may be a chances of displacement of brain tissue, not increase in serum pH. So here displacement of brain tissue we can find in cases of, so displacement of brain tissue we can find. Okay. So we are going very slowly, so let me fast it up. Almost only 25th question we have come now. So which immunoglobulin can cross the placenta, whether it is IgM, IgE, IgA or IgG? So which immunoglobulin can cross? 75 option. See, if you look at the immunoglobulins are nothing but they are antibodies. These are the antibodies or glycoprotein which is produced by the WBC, So maternal immunoglobulin IgG, it will cross across the placenta. Okay. So the correct answer for this question is IgG. If you want to go through a detailed explanation after the class, I will post the notes in my Telegram group. There you can go through the complete notes. Next, A 70-year-old female patient is scheduled for surgery in 2 hours. So, which of the following laboratory findings warrant the most immediate notification of the patient? So, the patient here, he is 70 years. See, the age is 70 years and she is posted for surgery in 2 hours. How many hours? In 2 hours she is posted. So, which lab finding we have to tell to the physician? Whether it is prothrombin time 22 seconds or HB level 11 gram per deciliter, creatinine 1 gram per deciliter or potassium 4.6 to 4.6 milliequivalents per liter. See, hemoglobin level, this is a correct HB, whereas 0.6 creatinine level is 0.6 to 1 gram per deciliter. This is a normal value. Potassium is 3.5 to 4.5 is considered as not 4.5, that is around 5 milliequivalents per liter is considered normal. If you look at the prothrombin time, this is very more. So, what is the normal prothrombin time? That is, it is around 11 to 13.5 seconds is considered as normal. But here the patient value is how much? It is around 22 seconds. See, that much of more value means there may be a chances of bleeding after surgery. So, when the prothrombin level is elevated, immediately we have to notify the physician. So, physician ki manu inform cheyali. Prothrombin time anedi ekku unnappudu వాళ్ళకి సర్జరీ తర్వాత బ్లీడింగ్ అయ్యే ఛాన్సెస్ ఉంటుంది. అది ఎప్పుడు తక్కువ ఉండాలి, సో దట్ బ్లడ్ అనేది త్వరగా క్లాట్ అవుతుంది. Okay. Which of the following laboratory test is more important to evaluate when preparing to administer digoxin in a pediatric client who has congestive heart failure? Serum magnesium levels, serum potassium levels, serum sodium levels, serum chloride levels. Here the question is digoxin. Digoxin they are giving. What is a normal arrhythmia? Arrhythmia is irregular heartbeat, right? Why digoxin is given? Digoxin is mainly to treat arrhythmias. It is mainly to treat arrhythmias, right? And here there is congestive heart failure. Congestive heart failure means CHF means where the heart is unable to pump the blood. So, where the heart is unable to pump blood. So, when digoxin is given, we are supposed to check the serum potassium levels to prevent hyperkalemia. So, to prevent hyperkalemia, we are supposed to check the serum potassium levels. So, the answer for this question is 77B. Next question, 78 question. So, which of the following is an appropriate instruction for a client who is scheduled for an outpatient encephalogram? So, outpatient encephalogram. NPO for at least, NBM for at least 6 hours before the procedure, removing all the hairpins, instruct to have some of the scalp shaved, draw blood samples of glucose levels 2 hours before the procedure. See, electroencephalogram where the head is usually shaved. Patient will be on NBM, head is usually shaved and the electrodes are placed on the head, right? But here electroencephalogram is we are inducing electric current. అంటే మన ఇక్కడ పేషెంట్కి ఎలక్ట్రిక్ కరెంట్ అదే ఇస్తున్నాం. సో ఎలాంటి మెటల్ ఐటమ్స్ అనేది పేషెంట్ పైన ఉండకూడదు. సో ద పేషెంట్ షుడ్ నాట్ హ్యావ్ ఎనీ కైండ్ ఆఫ్ electrical items on their body. So we are going to remove all the hairpins on the patient. If the patient has any metal items like hairpins or on head, any hairpins are there, we are supposed to remove that. Next question. The earliest sign of increased intracranial pressure is pupillary reflex changes, change in level of consciousness or altered sensation or decreased blood pressure. See, here we are talking about increased intracranial. So, within the brain. So, here we are talking about our brain. Okay. So, in the brain when there is increased intracranial pressure, what we will notice? Which one? 79. So, 79, all of you answer. 79B, yes. So, Kritika Rajwell, you have told correctly. So, here we are going to see for the changes in level of consciousness. Because the CSF inside the brain, it maintains normal ICP. The CSF, cerebrospinal fluid, it maintains normal intracranial pressure. When there is a head injury, there may be a chances of altered level of consciousness. Next question. Which of the following symptoms occurs most frequently in a patient with acute pyelonephritis, which should be monitored by the nurse? Rebound tenderness in left lower abdomen, flank pain on the affected site, abnormally low pulse rate or low grade fever. So, what is the general meaning of this pyelonephritis? What is the general meaning of this pyelonephritis? So, pyelonephritis is inflammation caused by infection of kidneys. Due to infection of kidneys, there will be inflammation of the kidney. So, at that time, we are going to check for, so flank pain on the affected side. Flank pain is here, this is the abdomen, right? So, this is the abdomen. So, this is a flank region. So, these are called the flank region. So, we are supposed to notice flank pain on the affected side. So, here the patient, they didn't mention the right side or left side. So, flank pain we are going to notice due to pyelonephritis. So, this is where the kidneys are located, right? On the posterior side, we will find the kidneys. So, we are going to notice for the pain on the affected side. Next question. The purpose of plasmapheresis in a patient with Gullian Barre syndrome is to restore albumin levels in the blood, to remove circulating antibodies in the blood, remove excess fluid from the bloodstream, or all of the above. See, plasmapheresis is the procedure where we will remove blood plasma, where plasmapheresis is a procedure where we remove blood plasma from the body. And this Gullian Barre syndrome, GBS is an autoimmune disorder. Their own antibodies, this is an autoimmune disorder, their own antibodies affects the patient, own antibodies affects the patient. So, and this is also a peripheral nervous system disorder, peripheral nervous system disorder. So, here in the plasmapheresis, we will try to remove the antibodies. So, the main focus in our this GBS syndrome is మనం ఏం చేయాలి, సర్క్యులేటరీ యాంటీబాడీస్ని రిమూవ్ చేయాలి. ఎందుకంటే వాళ్ళ ఓన్ యాంటీబాడీసే వాళ్ళని ఎఫెక్ట్ చేస్తాయి. ఇంకా ఈ జీబీఎస్ సిండ్రోమ్లో మనకి ఏంటంటే అసెండింగ్ ఇన్ఫెక్షన్, అసెండింగ్ టైప్ ఆఫ్ డిసార్డర్. అసెండింగ్ మీన్స్ ఫస్ట్ ద లెగ్స్ ఆర్ ఎఫెక్టెడ్. సో ఫస్ట్ ద లెగ్స్ ఆర్ ఎఫెక్టెడ్, then later the body will be affected. So this is called as the ascending type of infection where their own antibodies affect the patient body. So in the plasmapheresis we will remove the antibodies. 81 option B. Kiranmai, you have given the correct answer. Okay. Nurse has received a patient who has undergone a surgical procedure after conscious sedation. See, here the nurse has received a patient, surgical procedure, that too under conscious sedation. Which of the following assessment is most important for nurse to make post-operatively in this patient? Here under conscious sedation means they have induced sedation but the patient is conscious. So what is the main important intervention by the nurse? Post-operative period lo man deni paina focus cheyali, pain assessment paina, యూరిన్ అవుట్పుట్ పైన, ఎబిలిటీ టు స్వాలో లిక్విడ్సా, లేకపోతే రేంజ్ అండ్ డెప్త్ ఆఫ్ బ్రీతింగ్. ఓకే, సో కృతికా రాజ్వల్ హ్యాస్ సెడ్ రేంజ్ అండ్ డెప్త్ ఆఫ్ రెస్పిరేషన్. అవును, ఎందుకంటే కాన్షియస్ సెడేషన్లో ఉన్నారు అంటే పేషెంట్స్ పోస్ట్ ఆపరేటివ్ ఫేజ్లో మనం పేషెంట్ది వైటల్ సైన్స్లో ఎక్కువగా రెస్పిరేషన్, బ్రీతింగ్ ప్యాటర్న్ పైన ఫోకస్ చేయాల్సి ఉంటుంది. సో ద ఆన్సర్ ఫర్ దిస్ క్వశ్చన్ ఈస్ రేంజ్ అండ్ డెప్త్ ఆఫ్ బ్రీత్. అండ్ దోస్ హూ హ్యావ్ కమ్ ఆన్లైన్, వెల్కమ్, గుడ్ ఈవినింగ్, అండ్ come and comment in the live section by joining my membership. There you can comment in the live. Okay, 83rd question. A 30-year-old patient, she is in first stage of labor pains. So onset of labor pains to dilatation of the cervix is first stage of labor, and she is breathing rapidly. and having difficulty coping with the contractions. So, which of the following acid base imbalance is affected in the patient? She is breathing rapidly means oxygen is not reaching to her brain and body. So, already I have told you, so respiratory alkalosis. So, not the options like metabolic alkalosis, metabolic acidosis, respiratory acidosis we cannot find, because the question itself says she is breathing very rapidly. She is breathing very rapidly. So, there may be a chances of lower oxygen available to the patient. So, this will cause respiratory alkalosis. Nurse Linda was caring, 84th question. Nurse Linda was caring for a patient who has had stroke. The patient gazes at nurse but has difficulty in producing speech in response to the nurse's question. So, here the patient has difficulty in producing speech. Ante the patient nurse ni chusi maatladalekapotunnadu. Okay. The patient follows instructions without any problems. The patient is displaying symptoms of what? Global aphasia, receptive aphasia and expressive aphasia or mixed aphasia. Aphasia is nothing but when there is a problem in the communication process, unable to communicate. Here the patient is gazing. Gazing means he is looking at the nurse, and is unable to communicate. So, that would come under which one? Global, receptive, expressive or mixed. So, the 84th question, the answer is expressive aphasia. He is looking at the nurse and is unable to communicate. So, the answer would be expressive aphasia. 84, it's 84C. Yes, Gangadhar, yes, you are correct. A 45-year-old patient who underwent exploratory laparotomy. Exploratory laparotomy is where they open the abdomen. Exploratory laparotomy they have done 5 days before, has presented with abdominal pain, distended abdomen, absence of latex. Absence of latex is where they are unable to, ante gas pass cheyalekapotunnaru. Inka bowel sounds anevi absent undi. Absence of bowel sounds ante enti? Bowel lo peristaltic movement anedi ledu. So, this is an indication of which of the following complication that is likely to occur. Flatus pass cheyaledu, gas pass cheyaledu, abdominal movements kuda absent undi, abdominal bowel sounds absent undi, inka abdominal pain undi, abdominal distension kuda undi. Distension ante మనకి ఆ పేషెంట్ అబ్డామిన్ అనేది ఫుల్ డిస్టెన్షన్ ఉంది, వాళ్ళు గ్యాస్ కూడా పాస్ చేయలేకపోతున్నారు. సో అదేం కేసు ఇది? పారాలైటిక్ ఇలియస్, పెరిటోనైటిస్, వూండ్ ఆర్ సర్జికల్ సైట్ ఇన్ఫెక్షన్. విచ్ వన్? Kritika Rajuvel, okay. So it will be 85A. Yes, 85B కాదు, it is peritonitis. See, bowel sounds are not there, bowel sounds are not there, bowel movements are not there, flatus is not being passed. So this is called as paralytic ileus. Paralytis means paralysis, ileus means intestines. So the answer is paralytic ileus. By what age child is expected to begin to use simple words to communicate needs? Here the question is communication. Begin to use simple words to communicate. అంటే స్టార్టింగ్ ఎట్లా కమ్యూనికేట్ చేస్తారు, ఏ ఏజ్ నుంచి కమ్యూనికేట్ చేస్తారు? వెదర్ ఇట్ ఈస్ 6 to 9 months, 10 to 12 months or 1 to 2 years or 2 to 3 years. Here they are asking at what age this child is expected to simple words eppudu start chestar. Simple words, so here that is A, this is A, this is B, this is C and this is D. If you want to comment live, put question number, that is 86A, 86B, 86C or 86D. So many of you have answered 86 Gangadhar, 86B Kritika Rajuvel, 86B. Okay, so you are correct. That is during 10 to 12 months the child will be able to use simple words. Here at the age of 10 to 12 months the baby will use simple words. Okay, normal visual acuity for a 4-year-old child is. So, the normal visual acuity for a 4-year child is 20/40, 20/60, 20/20 or 20/30. See, for assessing the visual acuity, we use what? Snell's chart anedi use chestam. Snell's chart use chesi, that is how much it is placed with 20 feet distance. If the person is standing here, the Snell's chart will be here, okay, with the words written over it, and the maximum distance here is around 20 meters. So, 20 meters, not 20 feet, 20 meters, and they will write a normal value is 20/20. Here they are asking about 4-year-old child. So, 4-year-old child ke 20/40 ya, 20/60 ya, enta. So, this is how a Snell's chart looks like. So, this is how a Snell's chart look like. Okay. So, here you can see 10/100, 10/100, 20/70, 20/50. So, these are the values here. So, here the child is 4 years of age. So, he is around 20/40 is normal in a, this is normal in a 4-year-old child. So, by the time they reach 6 years of age, the value will come by 20/20. So, 87th question answer is 20/40. Not C. Here only at age of 6 years it will be 20/20 where it is 4-year child it is 20/40. Okay. '88th question, 12 more questions to go. A nurse administered phenylephrine eye drops for a patient with ophthalmoscopic examination. Which of the following assessment findings should the nurse expect after administration of eye drops? See, the drops phenylephrine. Phenylephrine, it causes what? Vasodilation. Vasodilation. So, inside of the eye, if inside of the eye, I am administering this vasodilation drops, what it will cause? It will cause what? Pupil dilation. Right. So, what response we can accept? Constriction of pupil, hypertension, pupil mydriasis or pupil meiosis. So, here we can see pupil mydriasis because it will phenylephrine causes the vasodilation. So, the answer for this question is pupil mydriasis. So, if you look at the cross section of the eye, this is how it looks like. So, here in the eyes, so from here the optic nerve enters here, and here the back portion, this is the retina. This is the retina, and here the front portion we have the aqueous humor, and here back portion we have the vitreous humor. Okay. So, this vitreous humor will help to make the ఐ ఒక రౌండ్ ఆ షేప్ అనేది దేని ద్వారా మెయింటైన్ అవుతుంది అంటే ఈ విట్రస్ హ్యూమర్ ద్వారా మెయింటైన్ అవుతుంది. అర్థమైందా? నెక్స్ట్ క్వశ్చన్ 89th question. Which of the following manifestations is least expected in a patient with presence with meningioma symptoms? Increased ICP. Increased, ఇక్కడ క్వశ్చన్ వచ్చేసి increased ICP, increased intracranial pressure. So, which of the following manifestations we can see? My answer you have seen for this 88th question, na? Pupil mydriasis. Here now we are discussing about 89th question. Here the question is which of the manifestation is least expected? Least ante takku untadi. That is papilledema, pyrexia, headache and vomiting. What is the meaning of papilledema? Papilledema is swelling of the optic disc. Just now I have shown you, no? This is the optic nerve. This is optic nerve. Okay. Swelling of the optic nerve is called as papilledema. So, there will be problems with the vision. So, here the client has meningioma. So, which symptoms is least expected? Papilledema, pyrexia, headache and vomiting. So, the answer for this question is other than pyrexia, the pyrexia is the answer. So, other than this pyrexia, all the signs and symptoms we can see in increased ICP, increased intracranial pressure. Vision problem, headache, vomiting we can find. Except fever, rest of the symptoms will be there. So the answer is pyrexia. Okay, the definitive diagnosis of peptic ulcer disease is what? Here we are talking about peptic ulcer disease, that is the gastric epithelial lining we are talking. So here the patient has peptic ulcer disease. So what is diagnostic test? Urea breath test, upper GI endoscopy, upper gastrointestinal endoscopy with biopsy, or barium contrast X-ray, or the string test. Which one? 90th question answer. Those who want to come live, join membership and you can come live. So peptic ulcer is mainly formed in the upper section of the GI tract, and when we do this endoscopy, the camera, with the help of the camera, we will completely visualize the inner lining of the stomach, and we are also taking the biopsy here. So endoscopy with the biopsy will give a best results here. So the definitive diagnosis of peptic ulcer is upper GI endoscopy with biopsy, not urea breath test, upper GI endoscopy. Okay, which of the following site is best for a nurse to plan administer monovalent hepatitis B vaccine intramuscularly in a newborn? Here the question is hepatitis B vaccine in a newborn baby. Deltoid muscle, vastus lateralis, ventrogluteal, or dorsogluteal? Which one? See, in a newborn baby, if you look, more of the muscle tissue or more blood supply, or more muscle tissue are located in which region? It is located in vastus lateralis, that is in the mid thigh region. So manaki hepatitis B vaccine anedi administer cheyalankunnappudu mana newborn lo we will prefer the vastus lateralis site. So the answer for this question is, that is, I am tired. See, after this night duty, this classes, no, nidra bhayankaranga vastundi. Iroju night duty ledu, iroju night duty off, kakapothe nidra matramu oogipotunna nidra. Next question. Okay. While a healthcare team is performing respiratory arrest resuscitation, so almost they are performing CPR, respiratory arrest resuscitation, it is determined that the nurse did not open the valve to the oxygen tank and the client had been not receiving oxygen. She is giving CPR and there is no oxygen to the patient, right? So, which of the following ethical principle involved in this situation? Here the options are battery, null maleficence, fidelity and beneficence. Battery is, the meaning of battery is without their consent, if you are touching the patient, that is called as battery. And all these things are what? Nursing ethics, 7 nursing ethics we have, no? So here 4 they have listed out. Fidelity is being loyal and being dutiful. Dutiful ante మీ duties మీరు కరెక్ట్గా పెర్ఫామ్ చేయడాన్ని మనం ఫైడెలిటీ అంటాం. బెనిఫిషియన్స్ అంటే మనం ఇచ్చే ఈ హెల్త్ కేర్ ఏదైతే ఉందో పేషెంట్కి అది బెనిఫిట్ అయ్యగలిగేలా ఉండాలి, పేషెంట్కి రికవర్ అయ్యేలా ఉండాలి. నాల్ మ్యాలిఫిషియన్స్ ఈజ్ హియర్ we are completely cut down the oxygen supply and doing CPR. So you are doing harm to the patient, that is no harm policy you have given here. So the answer for this question is non-maleficence. Non-maleficence is the answer. Okay. Next question. Which lobe is responsible for touch? Which lobe is here? Which lobe is responsible for touch? Frontal, temporal, parietal or occipital? See, if you look at this, so here we have the frontal, this is temporal, this is parietal, and here we have the occipital. So which lobe is responsible for touch? 93. See, if you look at this blue color portion of the brain, this is the frontal lobe, right? And this is the parietal, this is the occipital, this is the cerebellum, medulla oblongata, which is for respiration, and this is the temporal lobe. And here if you look at the parietal lobe, what does this parietal lobe do? Parietal lobe is responsible for sense of touch and it is connected to the nociceptors. Nociceptors ante pain receptors anedi manaki parietal lobe lo untadi. అర్థమవుతుందా? సో టచ్ కానీ పెయిన్ రిసెప్టర్స్ అన్నీ కానీ మనకి ఎక్కడ దొరుకుతుంది? సో ద ఆన్సర్ ఫర్ దిస్ క్వశ్చన్ ఈస్ దట్ ఈస్ parietal lobe. Okay, next question. An aged client with diabetes mellitus is complaining of painless peripheral vision loss, is at risk for what? Cataract, uveitis, open angle glaucoma or closed angle glaucoma. Here the client has complaint of peripheral vision loss. So peripheral vision is the side vision. Here we are talking about the side vision is not there. And here the client has diabetes mellitus. So the chances of this peripheral loss of vision, here there are more chance of getting the open angle glaucoma. So the answer for this question is open angle glaucoma. Next question. Initial nursing action after the birth of a preterm baby. Here we are talking about preterm baby. Apgar score is 8. So nursing action should be what? Weigh the baby, do suction, inform the family members about the birth and sex of the baby, receive the baby in a pre-warm towel and dry the baby. It's a preterm baby ma, and Apgar score is 8. Okay. So Apgar score 8 means it is a healthy baby. It is a healthy baby, and but we have got a preterm baby. So the main nursing action should prevent hypothermia in the baby. And how we can prevent hypothermia? We should take a pre-warm towel. Check the vital sign. We should keep the baby in a, receive the baby in a pre-warmed towel. Okay. So the option D is correct. Receive the baby in a pre-warm towel and dry the baby. Next question. Okay, which of the following is used for visual assessment of neonatal jaundice? So neonatal jaundice, how you can assess? Wallace rule, Kramer's rule, Lund-Browder chart, rule of 9. See, Wallace rule is a rule of 9 for burns patient in babies, especially in babies, for checking the rule of 9 of burns formula. Kramer's rule is something where the jaundice, to assess the jaundice, that is physiological jaundice, from the, this is the baby here, this is the baby here. Okay. So from the head to toe assessment, head to toe assessment of jaundice will be done by the Kramer's rule. Lund-Browder chart, rule of 9, this is completely related to burns. Here we are not talking about burns, we are talking about neonatal jaundice. So we are talking about neonatal jaundice. So answer for this question is Kramer's rule. Next question, all of you answer, those who are now online. In terms of response to fire accident in hospital, here we are talking about fire accident in the hospital. Okay, so what is the RACE stands for? What is the RACE word stands for? హాస్పిటల్ కారిడార్లో మీరు ఎప్పుడైనా చూస్తే కారిడార్లో మీకు పెద్ద పెద్ద లెటర్స్తో ఈ రెడ్ కలర్ ఇలాంటివన్నీ కనిపిస్తూ ఉంటుంది అన్నమాట, ఈ హోస్ పైప్ ఇవన్నీ. సో వాట్ ఈస్ ద ఫుల్ ఫామ్ ఆఫ్ రేస్? రేస్ యొక్క ఫుల్ ఫామ్ ఏంటి? రెస్క్యూ అలార్మ్ కాంట్రాక్ట్ కంట్రోల్ ఎగ్జిట్, రెస్క్యూ అలార్మ్ కంటైన్ ఎక్స్టింగ్విష్, రెస్క్యూ అలర్ట్ కంట్రోల్ ఎగ్జిట్, రెస్క్యూ అలర్ట్ కంట్రోల్ ఎక్స్టింగ్విష్. సో ఎన్ఏబిహెచ్ రిలేటెడ్ హాస్పిటల్స్లో మీకు ఇది కంపల్సరీ కనిపిస్తుందమ్మా ఈ పర్టికులర్ రేస్ వర్డ్. So 97B, Gangadhar as well as Kritika Rajwell, you have answered correctly. Yes, so that is option B. Rescue, alarm, contain and extinguish. Next question. Which of the following is the most important initial care when the chemical burn is suspected? Chemical burns like H2SO4, H2SO4 కెమికల్స్ ఎప్పుడైనా పేషెంట్ పైన పడినప్పుడు ఇమీడియట్గా మనం ఏం నర్సింగ్ యాక్షన్ అనేది ఉండాలి? ఇమీడియట్లీ కవర్ ద బర్న్ ఏరియా, రిమూవ్ ఆల్ ద డ్రెస్సింగ్, ప్రొవైడ్ కామ్ ఎన్విరాన్మెంట్, ఎక్సెసివ్ ఫ్లషింగ్ విత్ వాటర్ విత్ 20 to 30 minutes you will flush with water. See, chemical burns is something where the first action should be this one. We have to flush the chemical for 20 to 30 minutes. Remove all the dressings, this is also correct, and immediately cover the burn area. Here this is we are talking about chemical burn. We are not going to cover, we are going to wash it with the water. Then provide the calm environment. So, during the recovery phase, after admission, during the recovery phase, to reduce the anxiety, we will provide the calm environment. This is the last option. So, the first priority option in a chemical burns is excessive flushing of water for 20 to 30 minutes. Whether the options are visible to you? Okay. So, excessive flushing with water for 20 to 30 minutes. So, what and all chemicals will be? So, corrosive chemicals like H2SO4 or HCl. So, chemical burns lo idi manam cheyalsinde. Then exclusive breastfeeding is up to 2 years, 1 year, 6 months and 3 months. Tell me, this is a very easiest question you can answer. 99th question. Those who are online, answer this one. So, exclusive breastfeeding is given for how many days? That is how many months? That is 6 months. So, the answer for this question is 6 months. Then last question of this session. Which medication should not be administered in the treatment of cerebrospinal fluid leakage in lumbar puncture? Lumbar puncture procedure appudu ఏ particular medication అనేది మనం should not be administered, which will not administer? Anti-inflammatory, steroids, antibiotics or anesthetic? Tell me. 99C you have given correct answer, Kritika. Now tell me the 100th question answer. So with this I wind up the session. Feeling sleepy? No night duty? Yeah, option D, anesthetic you will give. Here the medication which should not be administered, Kiranmai. So the answer is steroids. So the medication which is not be administered in the treatment of CSF leakage is 100B. Okay. So thank you for listening to the class. Those who have come live, put a like, share my channel, subscribe my channel, and let it reach all the people who are preparing for these exams, and let them learn well, and all the best for your exams. And NORCET 7 I am planning to take bullet points tomorrow. So let me know in the comment section if you are okay with taking class tomorrow, bullet points for you, so that it will be useful for you for NORCET 7 aspirants. Okay. So thank you with this. Okay, bye. Take care. Thank you. Good night, Kritika, Kiran.